how are the cells actually working? Are, in terms of your research and what you've seen with MRI imaging after, the cells differentiating into cartilage cells? Is it more of a paracrine effect? How are they actually working in the joints?
So look, historically, and you're saying all the right terms there with Paracrine Effect and differentiations. Look, historically we've always felt that stem cells have an ability in that regenerative medicine space because they can differentiate. Mesenchymal stem cells are what we call multipotent. They can differentiate into different cell lines along what we call the mesodermal lineage, and that particularly is more musculoskeletal type tissue, so cartilage, bone, muscle and fat. So we expected that was how they're going to actually disease modify, to improve arthritis, to regrow cartilage. However, there's not a significant amount of evidence that that actually occurs. The more recent evidence is that they work by a paracrine effect. I like to think of mesenchymal stem cells as a bit of a project manager. When they are injected into a joint, they're really assessing the local environment. They're looking at what's out of balance, and they're looking to balance it. So if they see a very inflammatory environment, they will push out anti-inflammatory factors to just balance the environment. And that often leads to pain and functional improvement and creates a healthier environment for the existing cartilage. The other thing which they will also see is if they see cartilage which is struggling, cartilage which is a bit quiet, it's not producing, the cartilage cells aren't producing a lot of cartilage, they will upregulate the local environment. They'll upregulate those local cartilage cells to express more collagen, so therefore we will see some aspect of regeneration. It's not because they themselves became cartilage, it's because they stimulated the local environment to upregulate and produce more cartilage.
Yeah, I think that was confusion because if you look at our websites, it talks about that. When you look at the actual research and researchers' thoughts on the trials, it kind of says something different, and that's what we were finding. Like when we're actually looking at the papers and the research, it says one thing, but then you go on every single website and it says, hey, they're turning into these cells and this is what's actually...
Yeah, and I think this is where patients do have to ask the right questions, and there's an enormous amount of very good information online, but there's a lot of misinformation as well.